Have you ever wondered if your therapist actually understands what's happening inside your brain when you're sitting in the chair? Because here's a truth that most people in the mental health field don't talk about openly. The gap between what neuroscience now knows about the human mind and what counselors are actually trained to use in session is enormous. And that gap has real consequences for real people seeking help. Today we're diving deep into the extent of counselor training in neuroscience-informed counseling competencies. What does that actually mean? Why does it matter more than most people realize? And what's being done about it? Stick around because by the end of this video, you're going to see the entire mental health field from a completely different angle. Let me start by painting a picture for you. Imagine you go to a doctor with a broken arm and they give you advice based on medical textbooks from 30 years ago, completely ignoring decades of updated research. You'd be outraged, right? You'd demand better. Yet in many corners of the counseling world, that's essentially what's happening with neuroscience. The research has exploded. The clinical application has lagged behind. And the people caught in the middle are clients who deserve the most effective care possible. So what exactly is neuroscience-informed counseling? At its core, it's about integrating what we know about how the brain actually functions, how it develops, how trauma affects neural pathways, how stress response systems work, into the therapeutic process. It means a counselor understands concepts like neuroplasticity, the brain's ability to rewire itself throughout life. It means understanding the role of the nervous system in emotional regulation. It means knowing how early attachment experiences literally shape brain architecture. These aren't abstract academic concepts. They have direct implications for how you sit with a client, what interventions you choose, and how you explain a client's struggles back to them in ways that reduce shame and increase hope. Here's where it gets really interesting. Research consistently shows that when clients receive psychoeducation grounded in neuroscience, when they understand that their anxiety isn't a character flaw but a nervous system response that can be worked with, something shifts. Their engagement in therapy deepens. Their willingness to try new strategies increases. Their sense of self-blame decreases. Neuroscience-informed counseling isn't just clinically effective, it's therapeutically empowering. But here's the uncomfortable question. Are counselors actually being trained in these competencies at a level that allows them to deliver this kind of care confidently and consistently? The honest answer is complicated. Graduate programs in counseling do include coursework that touches on human development, biological basis of behavior, and sometimes specific content on brain functioning. The standards set by accrediting bodies do acknowledge that counselors need foundational knowledge of the neurological and biological dimensions of mental health. That's the good news. The frameworks exist. The acknowledgement is there. But acknowledgement and deep competency are very different things. What the research literature on counselor education suggests is that neuroscience content, where it appears, is often siloed. It shows up in one course, maybe two, and doesn't get woven as a consistent thread throughout the training experience. A student might learn about the stress response in a theories course but never return to it when studying trauma-focused interventions. They might hear about neuroplasticity once but never practice how to communicate that concept meaningfully to a client who feels hopelessly stuck. The depth issue is significant. There's a real difference between knowing that the amygdala is involved in fear processing and being able to use that knowledge to guide a clinical decision in the moment. Neuroscience-informed practice requires what researchers call translational knowledge, the ability to take brain-based information and apply it practically in the room with a client. Many counselor training programs develop the former without adequately developing the latter. There's also a faculty expertise issue that doesn't get enough attention. Counselor educators themselves represent a generation largely trained before the neuroscience boom in clinical literature really took off. The surge in accessible neuroscience research, the work coming out of interpersonal neurobiology, polyvagal theory, and related fields has happened relatively recently. Faculty members who are passionate about it seek out training and bring it into their classrooms. But that's largely driven by individual initiative rather than systematic program-wide curriculum design. Think about what that means for students. Whether you graduate with strong neuroscience-informed competencies can depend heavily on which faculty you happen to encounter during your training, which is an equity issue as much as a curriculum issue. Now let's talk about what those competencies actually look like when fully developed, because this matters. A counselor with strong neuroscience-informed competencies can explain to a client why their body goes into freeze mode during difficult conversations, and why that's not weakness. They can recognize when a client's nervous system is dysregulated and adapt their therapeutic approach accordingly. They understand the window of tolerance and know how to help clients expand it. They can talk about how relational safety actually supports neural integration and growth. They know that the therapeutic relationship itself is a neurological intervention because co-regulation between counselor and client shapes the client's nervous system responses over time. These are not just nice-to-have additions to a counselor's toolkit. For clients who have experienced trauma, chronic stress, or early adverse experiences, a counselor's neuroscience literacy can literally change the effectiveness of treatment. So what's being done to close this gap? There are some genuinely exciting developments happening. A growing number of professional training programs are emerging that specifically target neuroscience-informed practice. Continuing education offerings have expanded significantly. Professional associations are increasingly including neuroscience content in their conference programming and publications. Some counselor education programs are actively redesigning curriculum to weave neuroscience through multiple courses rather than limiting it to a single module. There's also growing scholarly conversation about what a specific set of neuroscience-informed counseling competencies should look like. Researchers and educators are working to articulate not just that counselors need this knowledge, but precisely what it should include and how it should be assessed. That kind of specificity is exactly what allows training programs to become accountable for developing it systematically. The movement toward neuroscience-informed practice is real and it is gaining momentum. But momentum isn't the same as universal implementation. Right now, a graduating counselor's preparation in this area is still highly variable depending on where they trained. Here's the deeper psychological truth that ties all of this together. When we understand the brain, we understand behavior differently. We move from judgment to curiosity. We move from why won't this person change to what does this person's nervous system need in order to feel safe enough to change. That shift in perspective changes everything about how a counselor shows up in the room. Clients who work with neuroscience-informed counselors often describe feeling seen in a different way. Not just emotionally validated, but actually understood at a fundamental level of how they're wired and why they respond the way they do. That experience of being understood without judgment is itself healing. And that's not a soft claim. That's neurobiologically grounded. So what does this mean for you, whether you're a counseling student, a practicing clinician, or someone who sees a therapist or is thinking about starting? If you're a student, advocate for neuroscience content in your training and seek it out proactively. If you're a practicing counselor, the continuing education landscape is rich right now and the investment pays off directly in clinical effectiveness. And if you're a client, you deserve a therapist who understands your brain, not just your story. The extent of counselor training in neuroscience-informed competencies is improving. The field is moving in the right direction. But there's meaningful work still ahead, and the urgency of that work is measured in the outcomes of real people sitting in real therapy rooms right now. The brain changes throughout life. The counseling field can too. And the more we close this training gap, the more powerful and accessible truly effective mental health support becomes for everyone. That's a future worth working toward.